Okay, shall we get started? Since it's just 10. One detail I'll just mention, I noticed that when you were introducing yourselves yesterday and you spoke about what you've learned so far, everyone was speaking about what you learned about medical anthropology, which is good. That's very much the focus of this too, but I realized maybe I also should be emphasizing this other subdisciplinary category of psychological anthropology, because much of the material that we've already covered is in both fields, or one or the other. It kind of depends on the particular reading. Obviously, Obiasekari's work on depression and Buddhism, is a classic of psychological anthropology. But much of this work, goes into both fields. There's some overlap, but just want to make you aware of this other term. As many of you are in psychology programs, you could also sort of, market yourself as a psychological anthropologist as well, which you can do as long as if you're doing field work, ethnographic field work, you're a psychological anthropologist as well, and you can go to those meetings and give papers and all that. Dr. Sudarshan, when in the U.S., I refer to him as like a psychological anthropologist. In India, in Kerala, to my colleagues, in anthropology, because that's the best way to make sense. I mean, I could say, oh, he got his degree in psychology, but he does ethnographic work, and his work has very much similar sensibilities to psychological anthropology. I could give a long explanation, but it's the same meaning. So I just want to make sure that category is also out there for you. But today, today it's also still both fields. I was going to say today because we're looking at non-biomedical systems of healing. We're looking we're more firmly in the field of medical anthropology. But, since Claudia Long and Eva Janssen's work is focusing on depression, it's equally psychological anthropology. So I suggested yesterday, because of time after seeing the rest of the film, that you choose one of the two articles on Ayurveda to read. I think you, Shri Parvati, is that right? Yeah, I guess you weren't here, so you didn't get that narrowing down of the reading, but hopefully, the rest of you did. And I think you already know some of this work. You said before you knew Harisha's work and you'd read Claudia Long, so this is, I'm sure, already familiar to you. Let me. I don't want to take time, going through these works, telling you the meaning. I'll just again ask you what you're getting out of the piece you chose to read on Ayurveda. And then we'll talk about Chinese medicine, and I want to have a little time before we break to talk about my own work on Ayurveda. And we want to do all this, before our break, because at the break, Dr. Rennie Thomas will be arriving, and the second half, he'll be talking about his work. And currently, he's been working on Unani medicine. So let's hear a few comments. I mean, from those of you who read Harish Narayan Das's of spineless babies and folic acid on evidence and efficacy in biomedicine and Ayurveda, what did you take away from that article?
The West has had a history of taking on stuff from Eastern medicine and Ayurveda, without looking at the theoretical background of it. Mm-hmm. And just here it's mentioned like they expropriate drugs from pharmacopoeias worldwide and jettisons the theory underpinning them. Or it could be the drugs or the therapeutic practices without correctly understanding the theory that is the background. So it is, I think we discussed this in one of the classes. Somebody mentioned how the romanticization works. So they are just taking the things that they require without completely understanding the theory behind it. Mm-hmm. So that was one thing that came up. They give the example of how somebody took the Indian hemp, the cannabis for treatment, and then without understanding the theoretical
or the epistemology that goes with it. Yeah.
So there have been examples that have been given. Then it was quite interesting how the spineless babies and folic acid I was actually looking forward, and it started off with the introduction and the history of how it is. It got to that quite later. And it also mentions how the efficaciousness is no guarantee that claims to a body of knowledge as legitimate.
Yeah.
So just because it works doesn't mean that the body of the knowledge underlying that is empirical, for lack of a better word. That is there.
Yeah, right, yeah. Effectiveness doesn't guarantee perception of validity of the system. Yeah, right. Because the patients, even if they had relief of their symptoms from Ayurveda, they want to have some allopathic biopsy or something to confirm,
Or
this.
they come with pre-diagnosed.
Yeah, they come.
Biomedicine and then go to Ayurveda because biomedicine maybe didn't really give them the satisfied result or.
Okay. Okay, yeah, exactly. That's one of his things. They come pre-diagnosed, in allopathy before they arrive in Ayurveda. Any other thoughts on this article? Yes.
The same thing is the physicians and doctors themselves find the comfort in using these biomedical vocabularies, like
Yes.
using an X-ray or taking a blood test, because the whole conversation that is happening between the patient and the physician is in the terms of biomedicine predominantly.
Right. Right, and that's one of Harish Narayan Das's main focuses here, and much of his other work on how sort of biomedicine dominates the conversation, dominates the ideologies and the epistemologies of medicine, even for people in Ayurvedic medical education. And so he's trying to show how, Ayurveda, is being neglected. And I think that, Teresa, actually, what about Dr. Teresa? He's much of this is based on his work with Dr. Teresa, this Ayurvedic doctor in Madras. What do you get from her? How does she work as an Ayurvedic doctor? Yes.
She doesn't use the biomedical terms. She tries even if there was this case of a lump in her breast,
Yes.
the patient said, can I go and actually get a biopsy and everything. So, but then the doctor was like, if you want, you can, but she was very dismissive of the term of doing biopsy or saying it's cancer. I think that was her actually just sticking to the terms of Ayurveda and just going, actually following what Ayurveda was and not in the kind of introducing the Western medicine terms into it.
Right, exactly. The appeal, I think, of Dr. Teresa is that she's a true believer, in the Ayurvedic system, and she's going to go with the whole system and use the Ayurvedic category. She's the exception to this tendency to, take a particular treatment that might be effective and jettison the ideology. She takes it all together, right? And so, right, and the patient you mentioned with the concern about the breast growth, she's worried about it being cancer, and Dr. Teresa says, I don't know what cancer is, which is in many ways a provocation. Of course she has heard of cancer, but in the Ayurvedic lexicon, this is not a category, which does not mean that Ayurveda lacks an understanding of growths,
Another viewpoint of viewing somewhere it was written, Ayurveda doesn't treat the symptoms, rather the cause of what the issue is or the disease is. So it's not treating the lump as itself, it's treating what was the reason behind it.
Exactly, right. Yeah, the cause of the lump. Somebody locked out. Okay.
It's a doubt I have.
Yeah.
So, like she said, it is mentioned that Ayurveda doesn't treat it treats the cause of the disease.
Yeah.
But in between, it's also mentioned that even though there is no diagnostic Ayurveda is able to get it, they are able to treat the pain.
Yes.
So I find it a little contradictory, not contradictory, but like opposing kind of thing, because even though you're not able to get a diagnosis or get a root of it, you treat the thing that is there.
Right, yes.
So how does that, I don't know, I find it opposing in my head.
I think you're correct. I think that when he says that Ayurveda treats the cause rather than the symptoms, I think that's oversimplification. And he does it at another point in the article say that, oh yes, sometimes they do treat the symptoms. And so he even acknowledges the limitations of his own generalization. And as I was reading that myself, I was saying to myself, well, Ayurvedic doctors that I knew in Trivandrum, yeah, sometimes they treat the symptoms, and especially if, I think the situation is if maybe the cause or the doshic problem is not clear, then they may just do symptomatic treatment. There's a certain pragmatism in Ayurveda, like there is in biomedicine, that also coexists with theory and everything else. And what he's seen in this article, I also saw. I mean, and maybe you also know this too. I mean, he points out that many medical students in India who choose the Ayurvedic track are choosing it because they didn't get into the allopathic track. Okay. But Harish Narayan Das is especially intrigued by people not like that, who actually went into Ayurveda because of an interest in Ayurveda. And I've met people like that too, people like this Dr. Teresa. And one person is this Dr. Sundaran, K. Sundaran, who is discussed in Claudia Long's article, the other piece. She discusses his explanations of mental health and illness from speaking to him and also from a book he wrote on this. And he's very much working within the paradigm of Ayurveda, not jettisoning the ideology and the epistemology. And I've met people like this as well, in addition to Dr. Sundaran. In fact, and then one interesting individual I know is a allopathic psychiatrist at the mental hospital in Trivandrum, who just personally has been very interested in Ayurveda. He's interested in classic philosophy in India. He follows a guru. He goes sometimes to an ashram outside of Trivandrum. And so he's interested in a lot of classic Indian thought. And I have discussions with him about that. And he's an enthusiast of Ayurveda. And when the Ayurvedic students from Ayurveda College in Trivandrum come to the allopathic mental hospital to do part of their rounds, they do educational rounds where they go to visit the allopathic centers. This allopathic doctor is trying to convince the Ayurvedic students to be more enthusiastic about Ayurveda. So when they arrive at the mental hospital, they get an allopathic doctor speaking as an enthusiast of the system that they have chosen sometimes as a second choice. So sometimes the true believer can also be an allopathic doctor. And also in my own work, I have heard from several allopathic doctors that they have, it's varying opinions. Some people think Ayurveda is, waste of time. Some people think it has uses, and they don't see Ayurveda versus allopathy as contradictory systems, but as maybe complementary systems. The allopathic medicine is better for acute illnesses, and Ayurvedic better for some chronic illnesses. And that might be because, partly, there's an interesting article by a French ethnologist, Francis Zimmerman, that basically explains how Ayurveda sort of reinvented itself in relationship to biomedicine, during the sort of colonial period and the period of introduction and rising influence of biomedicine in India. Zimmerman claims that Ayurveda reinvented itself as sort of a gentler alternative, and that there were practices for acute care, and surgery, practices that were more invasive, that where Ayurveda ceded the territory to biomedicine. Okay, now you can do emergency care. We're going to specialize, we're going to continue our existence by emphasizing what allopathy doesn't do. We'll emphasize the gentle parts of our care, and that's how we know Ayurveda today as sort of the gentler alternative with fewer side effects that takes longer to do. In contrast with allopathy, which is fast, dangerous. So that's a sort of a colonial reinvention, according to Francis Zimmerman. I'll just put his name here if anybody wants to know. He's a French scholar, a Sanskritologist who read the early Ayurvedic text in Sanskrit, and so much of his research is based on that, not ethnography, but history and Sanskrit-based studies. And the article I'm referring to is called something about the gentle purge, the flower power of Ayurveda, something like that in the title. Anyway, moving on. And Harish Narayan Das, this is just one example of his research. He's followed up on Ayurveda in many different contexts, and he's actually spent quite a bit of time working on Ayurveda in Germany, where he says it is practiced more authentically than in most places in India. His explanation is that, for the Indian audience, especially Indian middle-class people who have raised in the dominant ideology of allopathy, Ayurveda is something they're always very skeptical of. And the Germans with their, Germany has this very much a history, and maybe Sudarshan encountered this when he was in Germany too, the sort of history of interest in alternative medical systems to biomedical standards. And Germany has been the place of the invention of several alternatives, including homeopathic medicine. And many Germans are very interested in India and romanticize India as a place of useful insights into health. And so Germans are very willing to try to, like Dr. Teresa's patients in this piece, buy into the whole ideology. So that's one of Harish Narayan Das's claims, based on that it actually has more of an appeal in Germany today. And he's also done research on German healing systems. The Kur, this kind of spa-based therapy that Germans do. He analyzes the Heilpraktiker, a local German creation that combines elements of Indian medicine and other ideas practiced in Germany. And one of Harish Narayan Das's purposes is to actually move the focus. He says, he complains that too many scholars from India are studying their own culture, that more people need to do what Harish is doing now, which is studying Germany. And actually he's teaching a course now in Ashoka University on film and medicine and ideology in Anglo-American cultures. And once he appeared in my class in New York via Zoom, speaking to my students in my South Asia class. There are several students who were from India and other parts of South Asia, a Pakistani student. He says, he told them, you are all studying your grandmothers. You should be studying Murphy's grandmother. That's what he advises his students quite often. Anyway, and what about Claudia Long and Eva Janssen, appropriating depression, biomedicalizing Ayurvedic psychiatry in Kerala? So Claudia worked at the same site where I worked many years earlier, the government Ayurveda mental hospital in Kottakkal, nearby Malappuram. And she, I think she went deeper into the Ayurvedic concepts of mental health and illness than I did. She's a German scholar. Okay, she's one of these Germans intrigued with Indian systems of medicine. And so what are your thoughts about if those of you who chose to read the Long and Janssen piece? What are some of the things you take away? Did you understand how their Ayurvedic doctors are trying to figure out what to do about the category of depression? I mean, like Narayan Das also observes many people who come to the Ayurveda Mental Hospital in Malappuram come also pre-diagnosed, or self-diagnosed, and using terms like depression. So Ayurvedic doctors must contend with these categories.
So throughout the article, she talks about how Ayurvedic practitioners are engaging with the biomedical concepts of depression rather than simply resisting it or completely defeating to the idea. But I have two observations to make. One is when we situate the whole debate within the structure agency debate, I feel like she is saying the whole, they are not passive agents, they are actively engaging with it. But even then there is an overlapping structure of biomedicine that is impenetrating, which I think is important to contextualize.
Right.
And another thing is, although they are actively engaged, she says there is an active engagement, all of that is true, but there is no other option. It's the question of their survival.
Right.
So I felt like, so I just wanted to make that as a point as to, even though there is an active engagement, it's the structure itself is in a way that biomedicine is an inevitable reality, and there is no way they can like completely resort to the Ayurvedic paradigm. So that's why I mentioned.
Okay, no, I think that's a very good observation. Yeah, I mean, I think the structure and agency are both there. Yeah, you do see that they have some autonomy and an ability to continue to use Ayurvedic categories, but they can't ignore depression as another category, and the biomedical hegemony is still there. So I think these are good points, and I think it's a situation where there isn't an answer, a solution to the agency structure dichotomy. They're both in flux, and we'll see where it goes with Ayurveda. I mean, and to some degree, she shows some success at developing these clinics. She even shows you the diagnostic indexes that are used to diagnose using Ayurvedic categories. So there's this effort to continue to develop this, but this is also developed as part of a depression clinic. So it's several things at the same time.
I also answered a similar question in my mind. Like, if we see the biomedicine, then there the doctor firstly finds the evidence, and then they try to give the medicines or treat that evidence, and when it's gone, the doctor and the patient are on the same boat and it's cured. But in case of Ayurveda, like many a times it happens that the doctor is into treating the symptoms. So the symptoms of either pain or illness or anything, it gets treated because the patient starts feeling better. But because it's not getting into that evidence part, so many a time patients are in the state of questioning, like whether I'm really cured or not.
Okay, right.
So in the case of Ayurveda, like who decides what counts as a legitimate cure? Is it the doctor, is it the patient, or who decides that? Because many a times they're not in the same boat. So that question I had in my mind.
Yeah, right, and that came up in Harish Narayan Das's article, because they needed the patient needed biomedical confirmation. But in general, I guess I'm not sure of the answer to that question. I think it's just a good question. She, as far as I remember, I mean, unless anybody noticed this, I guess Long and Janssen did not really address that issue. Who decides whether they're cured. I think they're focusing more on diagnosis and how the categories are established vis-a-vis Ayurveda. So yeah, I'm not sure. I mean, and possibly, I would say with depression, it might be a different situation from what you see in the Narayan Das article, because you have things like cancer, where there is a biomedical visual form of visual evidence, in a MRI, that you can use as confirmation. But for depression, even the biomedical psychiatrists who are very much in favor of the biomedical explanations of mental health cannot point to a specific thing. They can't show you a chart or a scan that confirms, depression or no depression. So I think in this case, perhaps the Ayurvedic reality determining cure might be more, might be more solid this time. But that's a good question to raise. Yeah, I don't know if anybody has really addressed that specifically.
So,
Yeah.
what is the Kerala model that you mentioned? This always mentioned your Kerala model.
What is?
In this paper that mentions you are citing your
Oh yes.
Kerala model. What is that?
Oh, she's citing. Yeah, it's there in the in the references. So they're citing my book, Mud Packs and Prozac, which is about Ayurveda, allopathy, and religious healing in Kerala, and then some of the other articles that I've written about the decline of possession and the growth of tension, and idioms like that in Kerala. So that actually here, I'll just open that file. Where is that? Because I'm not even sure. I was rereading the article, like, oh, they're citing me. I'm not sure. I didn't look up which thing they're citing of me. Sometimes it was clear from what they were saying, and there's sometimes they cited me that they were showing some different findings from the ones that I came up with. I guess they cited several pieces, yeah, including my book. So there's, if anybody wants to see those citations a little more closely. And then, yeah, I have an article, Resistance or Inaction, about the whole agency structure thing that has to do with not what you're seeing in this article in depression, but it has to do with the biopiracy issue and the global patent structures and what Ayurvedic practitioners are doing about that. Are there other thoughts about the Long and Janssen article from those of you who read it? Anything that we didn't bring up? Yes?
So I feel in an attempt to appropriate Ayurvedic psychiatry into the Western medicine, I think Ayurvedic practitioners have also started seeing it in terms of quantifying, making it more evidence-based, because they have also started making scales
Yes.
for diagnosing depression. No, it's based on doshas mentioned in Ayurveda. So I think it is also an attempt to make Ayurvedic psychiatry more relevant in context to Western medicine.
That's right, yeah, and I just put up one of the examples that you're talking about, the Rajas rating scale, having to do with the, Rajas, Tamas, and Sattva, yeah, the mental humors, the mental doshas, they're sometimes called. So yeah, they're trying to systematize, they're trying to inscribe Ayurveda in biomedical terms to sort of, claim a place on the stage, claim legitimacy. But Harish Narayan Das would always look at, to what degree are you always kind of then, giving in to biomedical ideologies but maybe you can do both to some degree at the same time. I think that you can actually do a clinical trial, to prove efficacy without compromising, your epistemology. In fact, that's been done. There's a clinical trial that was done by researchers at several institutions in different parts of the world, Ayurvedic and allopathic, where they compared a treatment for rheumatoid arthritis in Ayurveda to one in biomedicine, or to the standard of care in biomedicine. But it was not what Narayan Das says in the first article. It's not simply just taking the plant pharmacology and testing it according to allopathic standards, because the claim is you need the context of Ayurveda, you need the whole treatment, not just extracting one medicinal plant used in one particular treatment. And so what this study did is actually compared, they had Ayurvedic doctors using the Ayurvedic treatment and an Ayurvedic regimen altogether, and comparing that to the standard of care in allopathy. So they're doing Ayurveda as it's meant to be done. And then they look at the clinical outcome of both groups. And the finding of that article was that the Ayurvedic method was equally effective to the allopathic standard of care with fewer side effects. So Ayurvedic treatment, the allopathic standard of care, I'm forgetting the name of the pharmaceutical, it's actually one that has a lot of side effects that are problematic. And pharmaceutical companies are looking for new treatments without those side effects, but the Ayurvedic treatment, and the authors, interpret that there is some biochemistry going on with the interaction of the plant materials and the Ayurvedic medicines with the person's body, but then the other parts of the regimen of Ayurveda, which I forget what it was, diet, massage, something maybe, I don't really know, I don't recall, then may also have some additional effects. So that kind of study is possible and has been done in that particular case.
So this scale, I don't understand, like someone needs to have insight to fill up these questions, like they both point Ahanga. This scale is given to a person who probably has depression, and we ask him to fill this questionnaire.
Yeah.
And we expect him to say that he understands that he has no relationship with other people's ego. And we take that and we would say, do not obey the superiors who do think those. Because this must be probably elicited from someone who's watching him and knows about him.
Yeah.
Behavioral aspects. So how do, it's like copying the scales of the West and introducing various, we never had scales like this.
Copying the scales of what?
Western scales.
Oh, yeah, right. It's supposed to be, doing that, yeah. I mean, doing scales like the Western scales, but doing them using Ayurvedic categories. So this is like it's also doing a scale. It also, is vulnerable to the same problems that you're mentioning, So, you have to somehow ascertain from an interview with the patient whether they're experiencing, whether they are fully attentive, whether they have no relationship with other due to ego through the interview. Just as in biomedicine, you have to, or psychology, you have to assess through an interview other categories and other criteria. And you're going to be limited, by the time that you spend with the person on whether you know it accurately. But it's an attempt to use, to develop instruments similar to the bio. I think that they would say it's not simple imitation. It's not, they're not reproducing. It's imitation in the sense of instruments are being used, but the categories developed come from Ayurveda. So it's kind of both things going on there, you could say.
Could we really say that it is copying, like you mentioned, it is copying because none of this specifically goes to the Western ideology or even biomedicine.
Right.
These are the kind of questions that any kind of medical practitioner would ask their patient in order to determine if they are at risk.
Mm-hmm.
So, can you say that this is something that is explicitly biomedical or Western? I mean, I don't know if you're saying that because this is, at least to me, it sounds like it is more culturally appropriate and they are going with it. We are not copying the West, we are just,
that's right, yeah.
we are just trying to,
Yeah, I think the fact that it's a scale is the similarity, yeah.
because they didn't have standardized questionnaires earlier in Ayurvedic practice doesn't mean that they didn't used to do this. I mean, they might have been doing this, it's just that they kind of standardized it in order to exist in the literature. It's like, I am reminded of this article by Samson where he says the Western practice is the Addison standard.
Yeah.
Where everything is compared to that.
Right.
Even though they're saying that there is nothing else and this is the standard, it's just Ayurveda is being constantly compared with Addison standard of Western medicine or biomedicine.
exactly, right. Yeah, there is no biomedical scale for majoring rajas. Okay, I mean they're not competing with that. You know, they're trying to. But then there's definite similarities. Like in biomedical, in psychological assessments, you might ask whether somebody's restless and is able to concentrate and pay attention, which I don't think is a question of imitation or similarity. It's just that there are certain things that just are similar that different people from different systems notice. You know that the
Another thing is all the spirits, magic, all
Yeah.
those components are systematically deleted if you see from these.
Well, yeah, exactly. The whole issue of Bhut Vidya, yeah, exactly, is as she says, a problem. And there's different positions. You know, I'm more of the position of, well, it's a more she mentions the Graha diagnosis too, as well as Bhut Vidya. I think that they're actually different things. The Graha diagnosis, as Ayurvedic doctors explain to me, is more like, somebody might be spirit possessed. You know, I met people who are possessed, and it doesn't mean that you validate the possession as an actual spirit. You may or may not, but you do know the person is having an experience, and maybe they're acting according to some, I don't know, behavior of some yakshi, or some young man they knew who lived in their neighborhood who died, at a young age. And then the graha would be like the kind of personality being exhibited in the person's behavior. And the explanation isn't it's not a doshic explanation of the problem. It's because of something that's happened. And so I think that it's not, Bhut Vidya is not, and Graha are not really just being erased. And they're not necessarily, I mean, she mentions there are those who claim that these terms in Sanskrit, written over 1,000 years ago, may have different meanings from today, and they may simply refer to malign influences, which we could today call bacteria and virus and things like that, or stress, and they might be right. The Ayurvedic doctors who say that might be right, or maybe Claudia Long is right that they're actually cleaning up, to look modern. I'm not sure which one it is. It may be either one of those things.
But there are people, number of Ayurvedic doctors who say that there is spirit and who validates the other camp.
Yeah, that's true. And I'm actually reviewing a paper right now submitted to a journal for publication about the teaching of Bhut Vidya at the Banaras Hindu University Ayurveda program, which they offered a track in Bhut Vidya, and it got all this negative press, and then they withdrew it. And so this person has written an article about that. So it continues to be this this wild card issue in Ayurveda. No one knows quite what to do with. But I want to move on for the sake of time. Yeah.
Spirits and possession would perhaps come in the Tamas scale and not in the Rajas scale.
Oh, is it? Okay.
Yeah, it's possible. No?
It's there actually. I didn't see the comments properly.
Yeah.
So, like in Thomas scale, there is question number 5. Adnan.
Oh, now I've lost it. But yeah.
So you have question number 5. Adnan, they say acknowledges being depressed and ill. My question is, like, if I have understood it right, there is never any term for depression, or even the term Vishadam came later. From what I learned,
Right.
What you said. So there must be a time there was nothing, they were only working out the doshas.
Yeah.
So there must be some point where contamination started happening.
Yeah,
right?
that's right.
So my question is that what is the original way of analyzing, assessing the mental status of a person before these other systems of medicine came? So this also must be a later this thing. Now this question this is acknowledges that is depressed. If we have to ask a patient, now I have to explain the term depression to him. Here it is self-understood. How do we ask a patient? Here the first line says acknowledges that he is depressed. And he asks me, the patient asks me, what is depressed? So how do I explain that then?
The patient asks you, what is depression? Okay.
Like if I say the question,
Yeah. Mhm.
I asked him, he acknowledges that it's represented ill.
Mm.
And he says, what is depression?
Ah.
So how do I explain it? Then I again use the biomedical one.
You mean if you're an Ayurvedic doctor in this situation?
If I'm an Ayurvedic doctor,
Yeah.
how will I explain depression?
Good question. Yeah, no, right. I mean, well, Vishadam is a term which is also like a popular term. You know, it's just a regular term in Malayalam meaning depression. It's kind of like the lay language has been appropriated into. So the patient will likely already know what Vishadam is because they'll just have grown up with that as a category. I know there's actually more on this. I want to move on just for the sake of time to Chinese medicine and maybe say a few words about my own work in Ayurveda. I think the piece by Kuriyama on Chinese medicine is just fascinating and one of the best things I've ever read. You know, one of the things we're trying to talk about here and what Long and Narayan Das are doing is work in this problem of translating between these different systems of thought about health and illness. And I've given you this chapter on the expressiveness of words from Shigeisha Kuriyama's book, The Expressiveness of the Body and the Divergence of Greek and Chinese Medicine. I think that this book is the best job anyone has done of translating between different medical systems. No one has yet done for Ayurveda what Kuriyama did for Chinese medicine and biomedicine. Now I've given you one chapter of a larger book, so you get just a little bit out of context, but you get to see his kind of thinking. And in this chapter, he's trying to explain this difference between the Chinese and Greek is his category because he's looking at an early time period where allopathy develops out of Greek medicine, or perhaps more accurately, a Mediterranean medicine that also includes Egypt. And by the way, that medical system, that original medical system, migrated to India and became Unani medicine, but also expanded in Europe and became allopathy. They have the Unani allopathy have the same origin, which is an interesting story, but it's more elaborate than what I've just said. But it's interesting to note as we're talking about Greek medicine. Although Kuriyama also widens the category to the Western perspective. So he's kind of jumping around in time between and jumping around in intellectual categories between a comparison of the sort of same early period in Chinese and Greek medicine to contemporary differences between Chinese medicine and allopathy. And one of the things that he, I like the kinds of comparisons he does. Like he's trying to solve the problem of why the Western doctors, the Greek doctors like Galen, were so troubled by elaborate, poetic, luxurious descriptions of things that you can feel at a certain points in the body, and the Chinese were okay with such descriptions. I mean, he basically tells you the Greeks and others in Western medicine tried to, this is feeling the pulse, but if you're talking about Chinese medicine, it's not feeling the pulse. Kuriyama explains that pulse is a Western concept. It's only about the heart beating, number of beats per minute. The simplification that Western physicians came up with. In China, you're reading mo. You remember how in the article he talks about mo. That's some Chinese term that has a character to it. And you're actually reading many things here. In fact, there's three different positions on either side of the wrist, and three different depths to which you push. So if you're laying the finger on with a certain weight, and you push a little harder, you're feeling something different, and you push a little harder again. So there's lots of things you're reading here. You're not just reading the pulse. But then to describe mo, the different kinds of mo, all kinds of different terms, even pictorial representations that you see reproduced in this chapter, were developed by the Chinese doctors. At the same time as the Western doctors thought such ideas were fanciful, you know, and maybe even a little bit crazy and irrational. You know, they were concerned with, as Kuriyama says in the article at several points, in the West there was a yearning for clarity. There was a belief that you could precisely describe what was happening in the body, and you could attain that clarity. While in China there was sort of more of an acceptance of clarity being elusive in their paradigm, or the elaborate poetic descriptions of Mo were, as Kuriyama says, seen as fatal to a secure science in the West. You know, poetic descriptions are, so the West, he shows you, struggle to describe Mo using various vocabulary. They struggle to describe the pulse using various vocabulary, and nothing satisfied them because, oh, how do we know that a heavy pulse is going to be the same to different people? So basically in Western medicine, they settled only on the numbers. The idea that where the numbers were reliable, they were clear. That's how you could achieve this clarity, by getting rid of vocabulary to describe pulse and only describe numbers. How many beats per minute? That's what you're looking for, okay? And meanwhile, the Chinese were happy to talk about a gazelling Mo or a rough Mo, you know, like wet sand. And for Kuriyama, this is a difference really in, as he says, how words mean. Did anybody feel like they understood what Kuriyama was trying to say and how words mean and how they mean things differently in Chinese and Western medical thought? At one point, he describes the word "wen" in Chinese. You know, he writes it as W-E-N. Of course, these are all, you know, Latin script versions of words that appear as Chinese characters, but, you know, I don't know how to pronounce it. But "wen" is a verb. You know, you can "wen" something in the Chinese language, and he gives you an example. Where is that? Like on page, I think, 96, 97, he talks about you can ask someone to "wen" filial piety. It's, according to him, it's not asking what something is, it's asking how, as if to ask what something is and what it is to do that thing at the same time. So in Chinese, you might ask a question that translates as, I asked about filial piety. In English, you don't just ask about something. And the answer in Chinese may be that always obey your parents. The answer doesn't say what filial piety is, it explains how you do it, okay? And then they might elaborate by saying, if this happens to your parents, then you do that, okay? The explanation is through specific examples and elaboration. What Kuriyama is trying to show you is that in the West, the concern in the functioning of the body was to tell what things are. Whereas in the Chinese system, the attempt was to explain what things were like. The Chinese idea is you couldn't explain what things were, you could only explain how they appeared to you. So in the West, they're trying to show what the pulse is and as some clear, accurate thing. In the Chinese system, they believe you can only describe what Mo feels like when you try to perceive it. You know, so it's rough and flowing. It's moving slowly over the land. And they believe that by elaboration of these poetic and descriptive terms, you became more accurate. So accuracy in the Chinese system is created in precision. He says both cultures were concerned about being precise, but in the Chinese system, precision is accomplished by elaboration and In the Western system, precision is accomplished by simplification in the form of like numbers and making the pulse into something that's only about beats per minute. So that's just a little window into what he's trying to do there. And the rest of his book, he has a chapter that's about how visual knowledge is used in Chinese medicine and Western medicine, how doctors in both systems saw the body, but how they saw it differently. Also has some really, I think, brilliant insights about the difference between the two systems. But just for the sake of time, I want to jump to, I'll just show you a few slides from my own work on Ayurveda and mental health that I did in the 1990s with Biju's assistance. This is where Biju works. This is the Ayurveda college where he works. So this is part of a slideshow that I've used in the past when I'm speaking to audiences not in India who know little about Ayurveda. I spend some time explaining what it is, that Ayurveda is, I call it an institutionalized medical system, because for many people there is this idea that there is biomedicine and that non-biomedical systems are all like, sort of shamanic, spiritual medicines. And I think a good way to describe Ayurveda is as an institutionalized medical system, like Chinese medicine. I mean, the three big institutionalized medical systems in the world are allopathy, Ayurveda, and Chinese medicine. Institutionalized in the sense that they're taught in colleges, okay? That there is a literary tradition. There's a series of texts like the Charaka Samhita, Sushruta Samhita, Chinese medical texts, which Kuriyama refers to in his article. There are allopathic medical texts too. But you already know a lot of this. This is, Ayurveda is taught in colleges. I mean, also in the Guru Sishya method as well in some cases. There are Ayurvedic pharmaceutical companies. The government of Kerala has an Ayurvedic research institute for mental diseases, which is also a hospital of treatment for Ayurvedic. Yeah.
The previous picture that you showed, it's like the symbols of Islam.
Yeah.
I didn't understand that.
That's right. Well, so this is the gate, the entrance to the factory of the corporate headquarters. And so they've done something that you often see in Kerala. They're representing the three main religions in the gate. So you have, I can't quite see who that is. I think that's some form of Shiva. Right?
Krishna.
Is that Krishna? Yeah, it's a blue Hindu deity. And you have the Christian cross, and you have the symbol of Islam. So this is just a typical thing in Kerala to show that your corporation is inclusive and open to all. And you'll see actually sometimes even like the taxi drivers and rickshaws will have a picture like this, to show to their customers that this is their attitude. And some of the slides here I have relate to one of the points that I made in my book. One of the things I found out from comparing Ayurvedic and allopathic treatments was that the Ayurvedic treatments were more pleasant to undergo, or maybe more accurately, less unpleasant. Because one thing that I was hearing from people I was interviewing who used these different therapies is many people found that allopathic psychiatric treatment was sometimes even scary. I mean, many people I interviewed had undergone electroconvulsive therapy, which is a system of therapy used where you give electric shocks at a high enough voltage that causes a seizure. And there's a whole story about biomedicine. This goes back to the belief that epilepsy and dementia praecox was the diagnosis at the time, were opposite things. And if you could induce epilepsy, epileptic fit into somebody with dementia praecox, you could cure them. And that's no longer the belief, the concepts in allopathic psychiatry, but they're still using electric shock anyway. So it's kind of lacking an etiology, as Narayan Das would say. and the antipsychotic drugs also had a lot of side effects. People didn't like how it made them feel. But when I interviewed people who did these treatments, taliporichil, the packing of this, I call it mud pack, medicated mud. It's got medicinal plants. You see these brown things. It's got some curd, and when it's all mixed together, it looks like mud. And these are just, for the sake of time, going very quickly. Basically packed down on the head. A banana leaf is put in its place. The patient just hangs out, walks around for 40 minutes, and fresh mud is replaced after that. There's an oiling of the head in Pichu. And when I spoke to people at the government Ayurveda mental hospital about these therapies, they reported how they made them feel calm and cool. The actual sort of visceral embodied reaction was a pleasurable one, or one that was not painful, whereas the responses to ECT and having antipsychotic drugs were never, oh, I loved ECT. No one said it made me feel so calm. It often usually causes memory loss, and you wake up not knowing what's just happened to you. And this is a way of administering medication that I'm just going to bypass quickly for the sake of time. There is, and this is a simple statistical analysis I did of this, and I wrote an article called "The Importance of a Pleasant Process of Treatment in Culture, Medicine, and Psychiatry" on this. And basically, of the patients I interviewed who were currently using or has previously tried allopathy, I had to deal with people who had tried different therapies and moved around. 14 offered some complaint about the effects of psychiatric medications or ECT during their allopathic treatment. So I, or Biju and I in some of these interviews, were not asking them how allopathy felt. We were talking about other things. They just they volunteered this complaint about the negative sort of visceral effects of the therapy. But of all the patients we interviewed who were using Ayurveda, none offered this kind of complaint about the physiologic. In a way, you might say that the Ayurvedic therapy are sort of spa-like therapies, as much as they are a medical therapy. Let me just look at how we're doing on time. I don't have the time right here anymore. So are we close to, yeah, we're close to our break time. In fact, before coming here, my wife and I had a chance to be tourists in India for a little while, and we were in Rajasthan and Delhi, and we stayed in this very nice heritage hotel outside of Udaipur, and they had a spa, and you had the option. They had a little in your room. You had a book of spa therapies, and some of these treatments you could have done at this hotel. And they're for quite a bit of money. 3,000 plus rupees. You could get something like Pichu, this oiling of the head. You could get this Ayurvedic massage. You could get some of the other treatments they did at the Ayurveda mental hospital at the hotel. So to me, this testifies to the whole idea of the pleasantness, the pleasant aesthetic, visceral experience of Ayurveda, because these are things that tourists will pay for, as sort of a pleasant embodied experience, for their, not just for pleasure, but also for health. I think people who go to the Ayurvedic spa at a nice hotel in India are hoping for some health improvement and some relaxation.